Good day, I am Ricame Gatchalian, 3rd year Block 2, and I will be performing Oropharyngeal and Nasopharyngeal suctioning. First, I want to share that all equipment used in this video are highly improvised. Let's define for suctioning. Suctioning is the aspiration of secretion often through a rubber or polyethylene catheter connected to suction machine. The purposes are to clear airway of secretion, to facilitate breathing, and to obtain secretion for diagnostic purposes. The equipment used in this procedure are suction machine, suction catheter, sterile gloves, irrigating saline or sterile water, large towel, you could have tongue depressor, and face mask. First, we must check for the doctor's written order for suctioning. This prevents potential errors for the patient. Checking identification ensures client safety through concept of correct procedure for correct client. Next, we assess the client's respiratory status. We also assess for chest sounds and audible secretion during respiration. This is to observe for signs and symptoms of complication and to know if client experiences pain during inspiration and expiration or there is labor difficulty in breathing. Next, we perform hand hygiene. This is to prevent transmission of microorganisms and prevent possible infections. Organize all needed materials. This is to check the quality of the equipment and to save and delegate our time for suctioning. Identify and explain the procedure to the client. Explanations can reduce anxiety and encourage cooperation with the procedure. Lower the side rails. This is to give access to position the patient. Position the client in a semi-Fowler's position if conscious. Semi-Fowler's position helps prevent aspiration of secretions. If unconscious, on side-lying position towards you. Side-lying position facilitates drainage of secretions by gravity and prevents aspiration. Place clean towel or drape on client's chin. This is to protect and prevent contact of secretions to the client. Set up the sterile container and open and pour the sterile solution. This strictly needs a septic technique to prevent infection. The sterile solution is used to flush catheter after each suction pass. We also open the lubricant and put it on the cover of the suction kit. By setting up the suction gauge, you must know that excessive negative pressure traumatizes mucosa and can induce hypoxia. This ensures the suction is functioning. Thus, we perform tube occlusion to test the suction apparatus. Higher pressure causes excessive trauma without enhancing secretions. This procedure, we put on sterile gloves. Reserve the sterile glove on your dominant hand for contact with the suction catheter and use the non-dominant hand with the tubing. Dominant hand will remain sterile. You may use a clean disposable glove on the non-dominant hand to protect yourself from exposure to mucous membranes and sputum. Holding suction catheter in sterile dominant hand, attach suction control port tubing of suction source held in non-sterile non-dominant hand. The non-dominant hand is not sterile, so it will control the suction valve. The dominant hand with the gloves on will manipulate the catheter as it is sterile. Septic technique is strictly maintained to avoid infection. Slide sterile hand from contact port to suction catheter tubing. Wrap the tubing partially around hand. This is to hold the suction catheter in place and maintain sterility and prevent contamination. Lubricate 3 to 4 inches of the catheter tip with irrigating solution. Since lubricant is provided, we will use that. Lubrication prevents mucosal trauma when catheter is inserted. Through the mouth, insert the catheter. Be sure the finger is not covering opening of the suction port. Apply suction when inserting the catheter can damage the mucous membrane. Through the nose, insert the catheter into an unobstructed nostril using a slanted downward motion. Be sure finger is not covering the opening of the port. This is to remove secretion from the pharynx. A suction catheter is inserted through the nose. Proper placement should be observed to ensure the removal of secretions, and applying suction when inserting the catheter may cause trauma to the mucosa. In the procedure, holding your thumb over the opening in the catheter, apply suction for 5 to 10 seconds at a maximum of 15 seconds. Limiting the suction time to 10 seconds or less prevents hypoxia. Next, withdraw catheter slowly while applying suction and rotating catheter between fingers. This is to minimize invagination of the mucosa into the catheter's tip and side ports. Rotation of catheter ensures all parts are reached. Place diffuse suction catheter in sterile solution and apply suction for 1 to 2 seconds. This is to prevent contamination and clear the lumen of the catheter. Encourage client to breathe deeply and to cough between suction, allowing 20 to 30 seconds interval between each suction. Never apply suction more than 3 times. Limit suction to 5 minutes in total. Coughing helps loosen secretions and may decrease amount of suction necessary, while deep breathing helps minimize or prevent hypoxia. Turn off suction source using non-dominant hand to listen to patient's breath sound and assess for patient need for repeat suctioning. Assessing the patient's need for repeat suctioning gives time to allow reoxygenation and ventilation, prevention of hypoxia, and to also evaluate the effectiveness of the procedure. Disconnect suction catheter from suction tubing. Suction should be applied only as needed to remove secretions, and this is also to facilitate for the next session of suctioning. Using the non-dominant hand, pull the cuff of the sterile glove catheter in gloved hand. This contains client secretions inside glove to reduce transfer of microorganisms. Position the client for support. This is to provide comfort and safety, and we must note that accumulated respiratory secretions irritate the mucous membranes and are pleasant for the client. Provide oral and nasal care. This is to keep bacteria under control and prevent possible infections from secretions. Discard equipment appropriately to prevent contamination and risk of infection. Wash your hands to reduce transfer of microorganisms. Record the procedure. Evaluate the client character of respiration after suctioning, client's tolerance in the procedure, the color amount and consistency of secretions, and record and document your assessment. Accurate and timely documentation and reporting promote patient safety. This also gives objective information on improvement and effects of suctioning. This is also to note for signs and symptoms of complications and provide appropriate nursing actions. Also, this is to note for the client's tolerance of the procedure.